Hello, everyone. Welcome back to the Premium Health Talk. If this is your first session of the day, welcome. This is our third day of bringing amazing speakers to share information and knowledge with you. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Premium Health Talks is the first international live series that CPBF is hosting 2021. These educational sessions are in collaboration with the Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, the Canadian Neonatal Network, the European Foundation for the Care of Newborn Infants, EFCNI, and GLANCE, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to empower families of premature babies every step of the way through support and education. We believe that through consistent information, access to helpful resources, and peer support inside and outside an ICU, we can empower families, ensuring they are ready to care for their babies. For these Premium Health Talks, we brought health experts from around the world and from all over Canada. We've been diving deep into topics affecting preemie health, from breastfeeding to parental mental health during the pandemic, from the importance of kangaroo care to the best practices to protect your baby's skin. If you need closed captioning, you can watch it live from our YouTube channel and enable closed captioning on the screen. I want to thank our sponsors, Medela, Water Wipes, and Prolacta Bioscience for their ongoing support. And please use the comment area below your screen to share your comments, your questions, your perceptions, and your stories. So I had the first session today with Dr. Johanna Kostenser from EFCNI, talk about the global impact of COVID-19 on neonatal care. And right here now, we are going to talk about breastfeeding, early nutrition, and the impact on the life course. This session will review the evidence and importance of early initiation of breastfeeding and systems of care that can help on providing the best care and nutrition to preterm babies. This will be addressed by presenting the baby-friendly hospital initiative for small, sick, and preterm newborns recently launched. We will also analyze the potential impact of inadequate nutrition and other adverse perinatal outcomes on disabilities and long-term consequences. And I have here with me, joining live from Uruguay, Dr. Pablo Duran, who is a medical doctor and PhD from University of Buenos Aires. Currently, Dr. Duran is the Regional Advisor on Perinatal Health at the Latin America Center for Perinatology, CLAP, the Pan-American Health Organization for the World Health Organization. Dr. Duran is an Associate Professor from the Department of Public Health, University of Buenos Aires. He has more than 25 years of clinical experience as a researcher and expert in epidemiology, monitoring and evaluation of policies and population interventions in maternal, newborn, and child health. Dr. Duran, thank you so much for joining us here today.
Thank you. Thank you very much, Fabiana, for this invitation. And thank you also to CPBF and to the colleagues, families, and parents that are participating in this session. I am really happy to be in here. And if you allow me, I will share, I will share the...
Yeah, you can share your screen. And for all of you watching us at home or from the hospital, please send your questions and your comments, and Dr. Duran will address them at the end of his presentation. I don't see your slides yet, Dr. Duran.
Can you see them now?
No. I can share with you. I can share, and you just let me know when to move forward. No, they're not coming to the stream.
Not now?
Not now, no.
Okay. So
okay. I can share and just let me know when to change the slides.
Okay, thank you.
You can go ahead, you can see you.
Yes, okay, thank you. So again, thank you very much. And the idea of this presentation is sharing with you, as it was mentioned, the importance of breastfeeding and mainly of early nutrition and early initiation of breastfeeding due to the main impact along the life course. We can move to the next one, please. And it was good having the previous presentations because most of the many of the most important comments have been highlighted. What do we know today about breastfeeding? I would say, and I imagine you agree with me, that we have learned a lot. We have a large amount of knowledge about the importance of breastfeeding for the mother, for the baby, for the family, for the society, in terms of nutrition, in terms of health, in terms of facilitating and promoting the attachment, the maternal and newborn attachment, neurodevelopment, but also because breastfeeding protects against many health adverse outcomes, not only during infancy, not only during the first days or months of life, but also along the life course. And the evidence shows that even cardiovascular and other chronic conditions can be reduced and prevented if breastfeeding is initiated early and is the main source of nutrition for the baby for at least the 6 months of age. So, and we can move to the next one, please. So, what would be the importance of talking about early initiation of breastfeeding during this presentation? Because, in the contrary of what I have just said, globally, only 2 out of 5 newborns are breastfed during the first hour of life. And as Dr. Kostenser mentioned, and it's not only due to the COVID pandemic, it is something that comes from even before the starting the pandemic. And in Latin America and the Caribbean, around 50% of newborns are not breastfed during the first hour of life. The next one, please. And it has been seen, and this comes from an analysis performed by WHO and UNICEF, that even when early initiation is around 50% of cases in the world, the highest improvement has been seen in those health facilities in which the populations where the proportion of institutional deliveries increased. But the issue is that in most of our populations in Latin America and the Caribbean, it's not the same case in other regions, but it is indeed in our region. More than 90% of deliveries occur at health facilities. But still, we see that even when we know about the amount of evidence supporting breastfeeding, and that almost 95 out of 100 deliveries occur in health facilities, only half of the newborns are breastfed during the first hour of life. And what is the reasons, which are the underlying causes that explain this situation? If we move to the next one, we can see that some, perhaps many, in most cases, institutional practices not always are friendly for the mother, friendly for the newborn or for the baby, or friendly for the family. Here you have, for example, the proportion of birth occurring by C-section, which ranges which averages from 20 to 40% in general, but you can see a huge variation. And on the right side, the outliers showed in some cases that more than 80 or 90% of deliveries in some cases occur by C-section. And this is a condition that does not contribute to early initiation of breastfeeding due to the condition of the mother, due to the condition of the baby. So this is just a flag showing that institutional practices do not contribute many times on promoting early initiation of breastfeeding. The next one, please. You can see here, and this comes from the same analysis from UNICEF, that in green dots, you can see the proportion of babies that were breastfed, but you can see that even when they continue being breastfed, most of them, or large proportion, between 30 and 40%, in different socioeconomic conditions, receive not milk, or milk that does not come from their mother. So these are also interventions that, along with what we have mentioned about C-section, do not contribute for early initiation of breastfeeding. The next one, please. So what needs to be done in order to change this situation? Because we know that early initiation of breastfeeding is perhaps one of the most conditions that contribute to continuing and sustaining breastfeeding. Obviously, that requires a mother's agreement in order to breastfeed their baby. So there are different strategies and interventions that need to be done that will contribute both on the early initiation of breastfeeding, but also on sustaining breastfeeding. One that we have mentioned is the increase in health financing, and this means improving the spaces, the facilities, the resources for initiating and sustaining breastfeeding within the institution, but also to apply the code for commercialization of maternal milk substitutes, improving the quality of care within the health institutions, as we have already mentioned, improving the access to counseling services even prior to delivery, during pregnancy, in order to help mothers not only to learn in terms of the advantages and also the conditions or the things that mothers need to learn about how to sustain breastfeeding, the questions that mothers have, but also to empowering mothers and families in order to request and ask for that care, that friendly care that contributes on early initiation and sustaining breastfeeding. Also, strengthening links between health services and the community. And here is where parents association, parents networks, and family networks are important, because advocacy do not come only from international agencies, academic associations, or the academia. It's only the role of the families, the parents groups that can contribute on strengthening and implementing the interventions required to this early start and healthy start for every newborn. And finally, establishing surveillance and monitoring systems in order to learn about the practices, to identify the not recommended practices, and to promote modifying those not friendly interventions. The next one, please. And I'm talking from the regional perspective, from Latin America and the Caribbean, which may be a bit different than what happens in Canada, but we know that within countries there are groups that suffer from different conditions that expose them to specific risk that may adversely contribute to nutrition, growth, development, and well-being. And the Latin America and the Caribbean region has been exposed for a long time to adverse socioeconomic conditions. And since the very beginning of this pandemic, the CLAC, the Latin American Center for Economics, and PAHO has presented this document showing the important impact on socioeconomic conditions of the pandemic in the Latin American population. And this is something that we have to take into account, because the adverse socioeconomic conditions contribute to not sustaining breastfeeding, and at the same time, not breastfeeding contribute to adverse socioeconomic conditions of the family, because mothers and family have to face for providing other nutrients out from the maternal milk. So this is a cycle that in the region we need to take into consideration, not only at the individual level, but also at the regional level. The next one, please. And as Dr. Kostenser mentioned, and this comes from a survey, a global survey on the sustainability of essential services at the global level, we are at this time analyzing the second round of this survey. The results that I'm showing here come from the survey performed last year, and based on this survey, we could analyze the disruption of specific interventions. You can see family planning, prenatal visits, delivery, institutional delivery, newborn care, nutrition support, and you can see that around 50% of the countries express in some way the affection, the disruption of these services. So not directly related to COVID, but indirectly related, our communities, our families were affected by not being able to access these essential services. And breastfeeding is adversely impact on that. And if we see the next one, this comes from an analysis that we have just performed, and it's ready to be published and disseminated. Can we move to the next one, please? Here you can see this is from the regional level, which should be the potential impact of COVID-19 pandemic on the rates of breastfeeding from now and up to the year 2030. And you can see that if at the regional level the rates were as low as something over 30% of breastfeeding exclusively at the age of 6 months for effect of the pandemic, this prevalence, which is low, will be also even lower in the next 1, 2, or 3 years. So this will have a great impact in the newborns, in the babies and families that, as we mentioned before, will have a long-term impact. So our babies being born during this period need to be supported, and the families and the health facilities, in order to sustain all those essential services that can promote healthy lives. And breastfeeding, early initiation, and sustaining breastfeeding are one of these key interventions. The next one, please. Inequities are present in our communities. Just as an example, you can see here the differences in terms of the prevalence of prematurity between socioeconomic conditions at the global level and at the regional level, Latin America and the Caribbean, where you can see in some way that almost the prevalence of preterm birth may double in the low socioeconomic conditions. So those babies that, for the condition of being premature, are exposed at different risk, being born in communities, in countries with low socioeconomic conditions, expose them to additional risk. So it is important to every baby to be breastfed, but most in those preterm babies, and mainly those being born in low socioeconomic conditions, in order to promote the best nutrition and the best care for these babies. The next one, please. So we need to move from the institution and disease center to the person, in this case, newborn and premature baby, and family-centered care. So we need to stress that the important person here are the newborns and their families, and looking for the best care from the other sectors out of the health sector, and within health sector, health facilities, managers, and policymakers need to be aware of this situation, because they are the responsible with the direct care provided by parents and families to promote this best environment and conditions. The next one, please. So we know that most of the babies being born at term need the general care and not specific conditions. But in those cases where prematurity or other conditions make special needs present, specific services and specific care need to be provided. And in this case, I would like to stress again that providing maternal milk, even being breastfed or through human milk banks, or expressing milk and provided mother's milk to the baby, are the best interventions in terms of promoting adequate care to these babies. The next one, please. It's been a challenge at this time from the global and regional perspective to work on those small and sick babies. And with WHO and UNICEF, we are promoting this specific approach. And linked to that perspective, the Baby-Friendly Hospital Initiative, adapted or looking specifically for preterm babies, has been developed and launched last year. And the following slides, we can move to the next one, stress the importance of addressing the main topics that are considered in this initiative: promoting skin-to-skin care, establishing and maintaining maternal milk supply in the way that is possible for the mother and for the baby, and facilitating the space utilization within the institution. Rooming need to be sustained unless a medical condition indicates that the baby needs to be allocated in an NICU and in another space, not with the mother. But in that case, and it was discussed in the previous session, there's an important need for providing a space for the newborn and for the mother to stay together, to allow the family to go to stay with the baby and to provide the care and the nutrition that is required. So this means adequating the institutions in terms of the health space, the physical space, but also the rules and the norms allowing parents and mothers to stay with their babies. The next one, please. And I mentioned before the importance of key indicators for surveillance. And this baby-friendly initiative for small and sick newborns highlight the importance of collecting and monitoring indicators at the individual level and at the facility level. At the individual level, the growth patterns of the baby, the feeding practices, sustaining skin-to-skin care, the results from the laboratory, clinical diagnosis, and maternal milestones of measures. And why I'm mentioning this? Because it's important for parents to be aware of the conditions, and these are the main information that need as empower, as a providers of care, need to be aware, need to learn, but also need to ask for this information to the healthcare providers, and also promoting, collecting, and informating this information. It's a key role for parents individually and as organizations. The next one, please. But even when the regulations and recommendations are in place, there are many measures that are not being accomplished, and this comes from an annual survey on the attachment of the recommendations of the commercialization of succedaneous of maternal milk. And we can see that many countries, you can see 31 countries, have legal measures covering the full breadth of breast milk substitutes, but many countries do not have these kind of regulations, or for earlier or younger babies between 12 and 35 months of age. 81 countries cover complementary foods in other regulations in terms of advertising and promoting their use, but still there are many violations of the regulations and norms that are promoted by the code. So it's important for parents and for associations to be aware of the norms and regulations within these international norms. The next one, please. You can see here the proportion of countries that responds that the key code provisions are not addressed or are violated. Those that are underlined as key provision of national legal measures, the provision of gifts or incentives to health workers, or the sponsorship of meetings of health professionals or scientific meetings, and nutrition and health claims are those that are least addressed at country level around the world. So the next one, please. So, and I'm finishing. So within the health system, the quality of care relies on two main pillars. One is the provision of care, which is responsibility of the managers, of the policymakers, and the health team, and imply the implementation of evidence-based practices to provide information and to adequate the system and the functional based on that evidence. But on the other side, we need to identify at the same level and with the same importance the experience of care of mothers, fathers, parents, and primary care providers. So both the health system and the families are contributors to the quality of care. So it's important to be aware of what is the best way of providing care, which is the best way of nurturing our babies. And we know that nurture is not only providing food, providing nutrients. It's also about providing quality of care, providing attachment, being present, and within this context, early initiation and sustaining breastfeeding is the most important initial intervention that need to be provided. And if those pillars, the quality of care provided by the health facility and the commitment and active involvement of parents with knowledge, it's present, the results will be important in any condition, and mainly in those newborns who are born sick, small, and with special needs. So the next one, please. So we know that different actors, different settings, and different interventions come together in order to promote and provide better results, or if they are not adequate, they will be, the consequences will be adverse outcomes. These different actors, settings, and interventions are related to the health services provided, the decision makers and managers at the different levels, the need for legislation, and this is important, the last but not the least topic, which is the society, the community, and the family, to learn, to be aware, and to promote that legislation, decision making, and management of the health system be aligned with the best practices and with the best evidence in order to achieve the best results expected. So the next one, I think it's the last one. So, oh, I'm sorry, the title is in Spanish, but what we know and what is missing, it's what we try to discuss during this session. There's a large amount of knowledge about early initiation of breastfeeding and the long-term impact, but the missing part is addressing the regulations, that the norms, and implementing the knowledge that we already have. This is related to institutional structure and sometimes fragmented interventions, and thinking only on specific and high-tech interventions. We forget providing the first level of care, which is the most important, and I'm talking about, obviously, about breastfeeding. Inequity and inequality that are present between countries, but also within countries and within communities. The perinatal situation and the impact along the life course, we know that those conditions adverse at birth that are not being adequately cared, nurtured, and provided the best care will have impact in terms of disabilities and the loss of human capital and social capital. So we need to stress the importance of person-centered care, sustaining and strengthening surveillance, monitoring, and asking for the key information and for accountability, and thinking from the rights and equity perspective. So it's the responsibility for each of us, independently of the role and the experience, but the responsibility for everyone to provide this comprehensive care and sustain in evidence. And the most important intervention that I addressed during this presentation is starting breastfeeding during the first hour of life, which will contribute on an improvement in the results, mainly for prematurity and sick newborns. I think it's the last one. We go to the next one. Yes, thank you. So the adverse perinatal conditions are the expression of inequity, and at the same time cause of greater inequity in the life course. So I hope that we all together can work on improving these conditions and promoting early initiation and sustain of breastfeeding. Thank you.
Okay, Dr. Duran, thank you so much for your presentation. You always bring this macro picture that we all need to understand, like from a big vision to where you're doing the work in our own countries. Because as you mentioned, there is so many inequities, inequalities within the countries. And I can see even in Canada, where everybody in the world looks, okay, this is a developed country, everybody has the same access, but we don't. Like families who live in rural areas, indigenous people, they do suffer a lot with our access to care. So I think my first question to you is, because obviously you're talking about standards and promoting attachment, sustained breastfeeding by having the family present and involved. And we also heard earlier today on a survey done on an international level of all the restrictions in ICUs around the world at this time. And, a year later, we're still facing restrictions. So how can we change that? It is a big work, right? Unit by unit, but how can we show that the importance of parental presence and engagement, it is necessary for the life course of the child?
Yes, this is an excellent question and also a difficult task. But I think that in that case, it is really essential the parents' associations, parents' group, to raise their voice in terms of working with legislators, managers, policymakers, in order to promote modifying, as I said, physical the facilities from the physical perspective, but also including regulations and norms, not to restricting the entrance to the NICU just for 1 hour in the morning and 1 hour in the afternoon. Parents have the right to be with their babies. We know that the resources sometimes are scarce, the physical space is not best, so that needs investment, that needs the decision makers to make the changes that are required. So this is a long-term work, but it's important to have the evidence and to go with the rights declaration, with this technical information, and try to find a way of promoting these interventions from those actors.
Absolutely. Okay, Dr. Duran, you are frozen. Okay, you're back? Yes. I think my next question is in terms of sustaining family-centered care, because there is this conversation going around if, when, or how we are going to reintegrate families in the care of their infants in hospitals around the world. So how do you see the future of family-centered care moving forward beyond the pandemic?
I see, and from the United Nations and the different international agencies, the active participation of the community is being day by day and in all the documents being present. So I see a promising future, and it's important that, as I said before, the parents' associations raise their voice, and from the international scenario, the place and the voice is being facilitated. So I hope that in the near future, each country has their own parents' associations, and even that those parents' associations be linked in order to learn from each other, share experiences, sharing materials, and to promoting that care and to being at the same level, as I mentioned, the two pillars of health facilities and community be real, be a reality in terms of guiding the care and providing the care to the newborns.
Absolutely. I think there is a movement happening with parents' organizations around the world that was initiated by EFCNI, and we just saw Dr. Constance presenting today, and Glance is here. So we are joining a lot of, bringing actually a lot of parent organizations together to advocate on a global level for best care. So we still have a lot of work to do for sure, but I think we set the foot on that journey, and I think we have to just look forward from here.
Yes, I absolutely agree, and we are always open to participate in these sessions and in other discussions in order to promote well-being of our babies and families.
Absolutely. So in one of your slides, I was really fascinated because you show the difference between the C-section and a vaginal delivery and the difference on the initiation of breastfeeding. Why do you have such a difference?
Because the higher the prevalence of C-section, the lower the early initiation of breastfeeding. As I said, because of the mother's condition, the newborn, because babies are separated until maternal recovery. So early initiation does not start, and then this is a risk factor for not sustaining breastfeeding. We know, and it's a global movement in terms of reduce the prevalence of C-section. We know that there are many differences between socioeconomic levels in terms of eligible or not eligible C-section. Perhaps obstetricians have a better explanation than me, but the issue is that C-sections are sometimes in extreme not necessary and affect, put at risk for the mothers, for the babies, and also contribute for not providing early initiation of breastfeeding. So this is something that it's important also to discuss during the prenatal counseling in order to discuss the potential risk and the potential consequences of C-section and the importance of early initiation of breastfeeding. So this is important also to be discussed and to develop materials for advocacy and on that regard.
Absolutely. And I think there has to be a lot of education, because I delivered my preterm baby here at 26 weeks through an emergency C-section. But right after my recovery, the nurse already brought the double breast pump. So I had to start pumping right away, which was a little overwhelming because I had just delivered prematurely, unexpectedly, through a C-section. But the importance of that moment for me, and today, obviously, I have the knowledge to know how important it was. But back then, she said, this is going to be good for your baby. And that's all I need to hear to start pumping. And I think that this is a kind of conversation and education from nurses to parents that have to occur, especially in those unexpected moments. Because one thing is, you're going to deliver early. There is a precondition, or if you schedule C-section, but in those emergency situations, the education always going to be the key and should lead the parent in that direction. One question for you in terms of sustaining breastfeeding, though, because here in Canada, we have a year of parental leave, which it supports the parents at home who choose to continue breastfeeding. How about in other countries where we don't have that privilege of having that extended parental leave?
Yes, this is very important topic. And this is why legislation is absolutely important. And the Canadian situation is not the case in most of the Latin American and Caribbean countries. In some countries have only maternal leave, in other countries maternal and parental leave, and the length of that leave is most of the time mostly shorter than 1 year. And there is another issue. I have read a paper 2 weeks ago about the importance of informal market and the mothers working in the informal market and sustaining breastfeeding, because legislation can apply for those mothers with a formal being involved in informal works. But we also know that in Latin America and the Caribbean, the proportion of population living under conditions in which informal work are the most common, those mothers even are not receiving the benefit of even a short leave. So the two issues are important. How to extend the leave for sustaining or for promoting sustained breastfeeding, but also how to protect those mothers in which this legislation does not impact.